terms, if a patient was admitted and placed on oxygen, we advise that when oxygen supplementation is discontinued, the patient must remain in isolation for another 10 days. This continued isolation provides clinical comfort that the patient is no longer infectious. Asymptomatic patients represent a conceptual challenge, since it is not possible to estimate where in the course of the viral shedding they are at the time point at which they test positive. We therefore advise that an asymptomatic...
I didn't catch that. Could you try again?
Sorry. We therefore advise that an asymptomatic patient must remain in isolation for a period of 10 days following the date of their positive results. I must mention that these guidelines have been provided by the World Health Organization. The Ministerial Advisory Committee has also submitted an advisory in this regard. Their advisory, after they've done a lot of analysis, proposed that the isolation period should be reduced to 8 days. After considering this advice and the guidelines by the WHO, the National Coronavirus Command Council, on the recommendation from the National Health Council, resolved to adopt the WHO guidelines. After consulting WHO and the chairperson of our clinician subcommittee of the Ministerial Advisory Committee, Professor Mark Mendelsohn, with due regard to the hard work they put into this recommendation, once we understand the basis of the recommendation, we have agreed that we should initiate further engagements between our Ministerial Advisory Committee, experts, and those of the WHO, so that we take this discussion forward. We believe that such a discussion will enrich the processes of policy making on both our sides, taking into account that WHO has also got the oversight of many countries, but we would like to ensure that as we go through this discussion, our views and the analysis of our own experts are well appreciated by the WHO. The Ministerial Advisory Committee has also done further work that relates to supporting health workers who have been exposed to infection. This matter is also being processed. The second aspect of the issue we wanted to table to the media and the public relates to the National Department of Health track and trace system. In the past few weeks, some members of the public may have received the SMSs from the Department of Health, giving them vital information, which may have included receiving their test results or an alert that they have been identified as a contact of a COVID-19 positive patient. These messages also prompt the user to provide further information on their condition in order to determine what clinical assistance and attention they may require. One of the clinical aspects of combating COVID-19 is the ability to detect positive cases early, track and trace their contacts, and refer them for appropriate management, whether it is immediate testing, isolation, or quarantine. The digital system that the Department of Health is currently using is called COVID Connect, brings an easy-to-use self-service portal to your cellular phone. It is freely accessible through WhatsApp and SMS. What also makes it more accessible is that it does not require for a user to have a smartphone, but it works on any mobile phone. This system enhances the physical effort of contact tracing and tracking, which is done by our community health workers and volunteers. It automates this traditional process and continuously engages the affected user. To explain this process further, the system works as follows. When a patient tests for coronavirus, the information is picked up from the lab form and informs the patient of the test results, whether positive or negative, by SMS. If the result is positive, the system prompts the patient for further information in order to identify their contacts. The system then immediately dispatches alerts via SMS to those contacts without disclosing the index patient's details and prompts them on the next steps to take. The non-disclosure of the patient's name is to ensure that their privacy is protected and also to make sure that after a contact details are made available, that person's privacy is protected. In addition, the system can geolocate the nearest quarantine and isolation facility for the user and the nearest healthcare facility for patients or their contacts who are experiencing symptoms requiring medical attention. Users can also get the latest COVID-19 news and information, prevention tips and wellness advice at the touch of a button. There is also a simple risk assessment tool which will screen users for COVID-19 symptoms and give them advice on whether they should self-isolate or seek professional clinical assistance. We're pleased to announce that since the system went live in June, it has yielded some positive results. Between June 28th and July 15, it has dispatched 674,380 SMSs to users nationwide and relayed 326,522 test results. And 39,463 users have engaged with the service. But this is not enough. The surge of this pandemic requires all citizens to participate in such innovations. As an individual at home or at work, once you receive this SMS, we urge that you take it upon yourself to appropriately respond as prompted. We believe that this method will significantly enhance contact tracing and allow us to quickly identify cases that we would not easily trace. We also want to inform the public that this track and trace service will not infringe people's privacy or data. In fact, one of the reasons we were delayed to implement and announce the system was to ensure that it passes the legal muster and adheres to the legal prescripts relating to personal information, confidentiality, and individual and data privacy. In this regard, the National Department of Health held a productive consultation with Madam Justice Kate O'Regan, who is the COVID-19 designate judge. Her guidance assisted the government to establish regulation on how to implement the track and trace system. We now take the opportunity to acknowledge the entities that the Department of Health has partnered with, namely Telkom, BCX, GovChat, PryKilt, and Bluebird. To access the COVID Connect, just add 0600 123456 to your phone book and say hello to us on WhatsApp. I repeat the number, it's 0600 123456. I believe that is easier, it's easy to memorize, and I believe therefore it will be easy to use. If you do not have a smartphone, just dial *134 *832 hash and follow the prompts. *134 *832 hash and follow the prompts. When you test for COVID-19, please supply your healthcare worker with your correct date of birth, physical address, and cell phone. You can then use COVID Connect to retrieve your results via your cell phone, or you will receive an SMS once your test results are ready. To receive your results on WhatsApp, just add "Let's Talk" to your phone book on 082 0468 553. Type in results on WhatsApp and follow the prompts. We look forward to many of our people taking part in this track and trace system. Thank you very much.
Thank you very much, Minister. I would like to invite, just for a short presentation, our guru in the Department of Health, Gorang Tana. Gorang, if you could please.
Thanks, Dr. Manzi. If I can just be allowed to share the screen.
Yes, you may share, Gorang.
Thank you. So we've set up a program called COVID Connect. COVID Connect is a mobile technology solution that has simple users and simple communication channels to allow our citizens to screen for COVID-19. It supports those who have tested positive for COVID-19 and anonymously alerts those who may have been in close contact with someone who tests for COVID-19. The system is very, very important in suppressing the pandemic. It's easy and accessible symptom screening tool makes it possible for members of the general public to do a risk assessment. It provides the capability to deliver test results. It allows us to ensure that those confirmed positive also receive self-monitoring support and ability to report and notify contacts anonymously. It alerts people who have come into close contact with someone who has tested positive and also receive self-monitoring support so they can take appropriate actions. Our main messages are screen regularly. If you're testing for COVID, make sure you supply a valid cell number so we can send you results, a correct date of birth so we can validate you and address and the place of residence. If you get a message saying you've been in close contact with someone who has tested positive, then follow instructions and self-quarantine. There are three main ways users of the system the users can engage with the system. The general citizens could complete a risk assessment to provide and receive advice on whether to continue as normal, self-isolate, or get a test. People testing for COVID-19 can receive their lab results, and people come into contact with someone who has tested positive for COVID-19. There are three main user journeys. So if you don't know what your risk profile looks like, send check to the number the minister's just announced, 0600 123 456 on your WhatsApp. If you don't have a smartphone or a feature phone, you're welcome to use the USSD channel, *134 *832 hash. Answer very simple questions and you will be given advice on what to do based on your answer to your questions. Anyone testing for COVID should ensure that they give a valid cell number, a correct date of birth, as well as an address. Once a lab result is ready, you will receive an SMS. Once you receive an SMS, send results to the WhatsApp number 082 046 8533. On the contacts get anonymous alerts once the contacts are reported by the index case. They need to follow the instructions on the SMS message by sending check to 0600 123 456. Answer very simple questions. They will be given advice on what to do based on the questions to the answers, and this must happen every day for 14 days. With respect to achievements, just over 7.5 million users have engaged the Say Hi WhatsApp bot. More than 355 million messages have been processed, 1.3 million users have been screened, and 2.5 million screens have been completed. The test delivery and engagement, just in the last 3 weeks, 9 provinces have gone online. Just under 700,000 SMS have been sent. 326,522 test results have been offered, and we've managed to get just under 40,000 engagements in this proof of concept phase. I'd like to hand over to Stefan, through you, Minister, for him to do a short demonstration on how it works.
Thanks, Gorang. Happy to do a demonstration. I'll start us off. Let me just share my screen. There we go. So the process starts by us receiving the COVID test results from public and private labs daily. We get that from the Bluebird Intelligent Medical Services provider. And once those are processed, we then generate SMSs to share positive and negative test results with the citizens. This is an example of the SMS. It would be, this is an official Department of Health SMS. Thank you for testing for COVID. Knowing your result is the first step to protecting yourself and your family. If you click on the link, that would take you then through to the GovChat WhatsApp channel. The word results would be pre-populated, and that starts the process for receiving your results. Here you receive a menu option with result where you can see results, you can monitor, or you can share close contacts. You opt in or accept the GovChat terms of use and then verify by typing in your date of birth. Once that's completed, you will receive your COVID test result. Here you can see that I've tested positive. We share some information around what it means to have tested positive and provide some links to additional information via the NICD and the Department of Health websites, as well as the National COVID Hotline. From that point, you then have the option to start the daily self-monitoring process or to declare your contacts via WhatsApp. I'll demonstrate the process to do the self-monitoring by typing the word monitor. Again, every day when you come in and reminded to do the daily self-monitoring, you'll just confirm that it's you and verify by typing in your date of birth. Then we start off by collecting your symptoms, the 5 key symptoms for COVID-19. I'll indicate that I've got shortness of breath. We then respond by saying if you're struggling to breathe while resting, it's important to contact your healthcare provider or emergency services. We also reference the national hotline. We then check if the individual, the index case, is in need of food support for them and their family. I'll indicate no in my case. And then we give some sense of what it means to self-isolate. And we gather some additional information around that process of self-isolation. We check how many rooms there are where you stay and how many people stay with you at home. This then gives us the ability to assess the need for isolation facilities in areas. We then gather some information around comorbidities or pre-existing medical conditions. So you can choose one or more of these options. In my case, I'll say I have no pre-existing medical conditions. And then we check your current, where you currently are isolating. I'll indicate I'm at home. And then we check your place of work, just to confirm if you're a health worker, a teacher, or work in a port of entry. I'll say none of the above. And then lastly, we just check your current place of residence. I can share my address by dropping a pin via WhatsApp or by typing out my address like I'm doing here. And then we use Google location services to verify the address and confirm that that's correct. This then finishes the process for self-monitoring your health via the GovChat process. I'll just quickly demonstrate the process for sharing contacts. And that's an important part of the process, as that kicks off the contact tracing process and allows us to notify people that have been in close contact with a positive case. Here I have 2 options to share my close contacts. I can do that by selecting them from my phone's address book, like I'm doing here. And I'll just select Goreng Tana as one of my colleagues that I've been in close contact with. I'll share that via WhatsApp, and I can repeat that process selecting more than one individual to share via WhatsApp, or I can type in the details directly into the message chat. Once I then complete the process, I can then type done, and that wraps up the process for sharing close contacts via the GovChat WhatsApp channel. We just check to see if there's any additional information to share. I'll say no. And there we go. That's the process for receiving your test results, for doing your daily monitoring, and for sharing your close contacts via GovChat. Thank you.
Thank you very much. Through you, Dr. Manzi, there's a second part to the demo, Minister, that's going to be for the general citizens, and that Debbie would like to do next.
Thanks so much, Goreng. I'm just going to share my screen. So this is a little video. I think some of what Stefan has shown you will obviously be repeated because there's similar flows, but this is the general information line that you probably all have heard of at 0600 123 456, as the Minister said, where you can get various pieces of up-to-date information. But if you're concerned that you may have COVID-19 or would like to do a self-screening, just type in the word check. It explains what the assessment is. First, you start by accepting terms and conditions, and there's information there around usage of data, etc. Obviously, it's very important to us that your privacy is protected. We ask a number of demographic questions, and these are really helpful for the National Department of Health in making decisions, understanding where there might possibly be outbreaks, and generally mapping risk of patients. So it's important that we gather this kind of information and not just screening for certain symptoms. As you can see, we also ask for information about pre-existing conditions, as they may affect your risk assessment. Once you've answered your questions about pre-existing conditions, you'll start to answer the questions about how you're feeling today. These are simple symptom questions, and as you can see, the little dots at the top of each little chat show you how many questions you have to ask. If you complete this screening multiple times, you don't always have to answer the demographic questions and the pre-existing conditions. You just go through these simple symptom questions, and you'll see here that you're given a result based on your different symptoms and given advice as to what to do. In this case, you're being asked to isolate. This is for the general citizens. Anyone can do this at any time, and although this is a demonstration of the WhatsApp service, there is of course a very similar service over free to use USSD. You dial *134*832#. I'm going to just share one last demonstration with you, which is if, as Stefan showed you, you are identified as a close contact and you receive an SMS suggesting that you should screen, you've got a slightly different version of the screening system, although you do take the same step to access it by typing check and sending check to 0600 123 456. Again, you're asked a simple set of questions around symptoms and various questions around pre-existing medical conditions. You're asked to give your name and surname and your place of work, just again to help, as you are a confirmed contact at this point, to help the National Department of Health in its tracking and tracing efforts. And if you go through this set of questions, again, you will then be given advice as to what you should do as a contact, and depending on what symptoms you have. I think it's very important to remember that if you are a contact and you do receive this message, it's important to try and repeat this daily for 14 days, as you should be in quarantine as a contact. Thank you.
Thank you, Lwazi. And Minister, that concludes the demonstration.
Thank you, Goran and team. Minister, we have received a number of questions. Firstly, we will start with questions that relate to the revised isolation guidelines. There's a question from Hassan Mohammed. The question is, are these recommendations implemented with immediate effect? There is also a question from Vuyo from City Press. Do these revised isolation guidelines apply to healthcare workers too? And will they have to take another test before returning to work or do a medical assessment? Minister, if you can respond to those questions.
Thank you very much. Let's deal with the last question first. And the question, yes, the guidelines apply to the healthcare workers, and there is an expectation that on day 5, they would have another test done, and then an evaluation would be made on the basis of whether that individual could have been exposed or not. And so indeed, it does affect it does affect even the health workers as well. Just repeat the other question.
The other question from Hassan Mohammed was asking whether these guidelines are implementable with immediate effect.
Yes, the guidelines are implemented with immediate effect. We must understand what that means. It's up to the quickest level of communication, so that we make sure that our members who are on the ground at the various institutions are fully informed of the guidelines. And so that's being processed so that they should be available to everyone as soon as possible, and therefore should be implementable as soon as possible.
Thank you, Minister. In relation to the track and trace system, there is a question that has been asked, has this approach been used in hotspots, specifically in the Western Cape, where there is resistance to Q&I? The next question, is the address a critical indicator? If so, how?
I'll leave the issue of the address to the team to talk about it. It's important for us to know where the individual is for purposes of guiding them, what are the nearest facilities that could be referred to, but also from the point of view of us confirming the location of the individuals, because all the people who have got positive results, we need the addresses to be able to plot. Then we know in each sub-district where the individuals are. In fact, they have to be located to the nearest possible point in a ward, so that when we sit here and plan the interventions, in terms of our interventions on the hotspots, we have to break the district or the metro down to sub-district, which is a cluster of wards. Those clusters must allow us space to find the best intervention depending on what else is happening in that ward. So, for example, if you've got a large number of people who are positive there, it does require us to have a team that's got a dedicated focus in terms of how to deal with those. But in addition, there might be other problems of comorbidities, therefore that have to be taken into account by the teams that are actually looking after that area. The system has been used in the Western Cape. A number of provinces were started much earlier. Western Cape was amongst those, and then indeed the system was used in the communities where we subsequently had to reinforce our track and trace mechanisms by bringing in community leaders to convene meetings with the community and talk to them about the issues of quarantine and isolation, bringing in people who are support groups of people who have been COVID-19 positive, and churches and various other structures on the ground. So you don't use just one approach, you use everything on the ground so that you try and find a mechanism to make the community understand what the approach is and therefore what is expected of the community. Yes, we did find that there was a degree of reluctance, excuse me, a degree of reluctance in the area of the Western Cape, particularly in the metro. And we've actually had a number of other social behavioral specialists getting involved in finding out why people were not very keen. And so we think that it's a matter of a continuous engagement that we have to involve in that particular situation. So that this is just one capability. It does not replace, for example, the views or the participation of tracing teams on the ground. And so it's a whole combination of things that are going on there.
Thank you, Minister. I think you've partly answered the next question. It's from Elrie Voigt. The question from Spotlight. The question is, what exact steps have been taken to ensure that users' data, that is test results, address, phone number, and their contacts, remain secure? Her second question is, will manual contact tracing still be used? If so, to what degree?
In this case, the ICT platform helps to augment the work which is done by manual contact tracing. It doesn't change it. In fact, with the increasing numbers, we have to increase the numbers of tracers. But it assists us now when we've got all of this. In addition, what we have not mentioned as well is the fact that we'll also be having call centers that continue to call. So it's a whole combination, a package of things that are involved. So nothing gets removed now, replaced by this platform. The issue of data security and the privacy and confidentiality, let me leave to the team to answer those questions. Here we go, Garang or the other members.
Thanks, Minister. So in terms of data and security, the systems are fully secured, and the responses that are provided on the WhatsApp platforms are directly fed to the contact tracing teams, and the contact tracing teams are therefore able to see which people have responded, which ones have not responded, from those that have responded who are at higher risk, etc. So, and the data is fully protected, and only the contact tracing teams, as well as the case managers in the districts, as well as provinces, have access to the data. No data is shared with any other person. Thank you.
Thank you.
Okay, so what you're seeing there is a press briefing on the revised isolation guidelines or de-isolation. You recall that initially what the department had said that it was 14 days. That's been revised down to 10, saying that it could even be 8. And what it really comes down to is the viral shedding. So viral shedding does not necessarily mean that it equates to infectiousness. However, viral shedding may decline, so it's important that the level below the infectious threshold before it becomes or it completely ceases. This is what they're talking about in the track and tracing. You saw the numbers that they were given out, and of course the safety or credibility of the system in protecting people's privacy, as when you received your results, you don't need a smartphone. That's what the minister has said. And of course, we will continue giving you more information on that. This, as the Worldometer says, our figures as a world has gone over the 40 million mark, and South Africa has reached 7th in terms of amongst the highest number of COVID number of cases, positive cases, and also active cases as well. So let's take you now to the United Nations, where inequality is said to be an obstacle to development. It foments social unrest